Did you know that up to 70% of travelers experience digestive issues abroad? Do you know how to protect yourself from it?
You're listening to Via Sana, a travel medicine podcast brought to you by AMSA IMU University with Professor Gerard Flaherty.
Join us as we explore what travel medicine is all about, how you can protect your health while traveling, and the exciting career opportunities in safeguarding travelers.
Welcome to our first ever episode of Via Sana, the travel medicine podcast. I'm Madhumita.
And I am Anusha.
So, in this first ever episode, we're going to be diving deep into what exactly is travel medicines. We're going to be asking all the crucial questions, the whats, the whens, the hows, and also, of course, the fun bits. So for that, we have two esteemed guests on our podcast today. Joining us all the way from Galway, Ireland is Prof Gerard Flaherty. Thank you so much for joining us today, Prof.
Oh, it's an absolute pleasure. Thank you for having me.
Why don't you tell our listeners on what exactly you do and how did you end up in this travel medicine field?
Okay, with pleasure. So I'm Gerard Flaherty from Galway in the west of Ireland. Yes, we are 11,000 kilometers away, but technology brings us closer all the time. And I have the pleasure of visiting your fine campus at IMU University in Malaysia on a regular basis. So I'm Professor of Travel Medicine and International Health at University of Galway, which is one of the premier universities in Ireland. And we have a long and enduring partnership with IMU University. And one of the expressions of that collaboration is our close working relationship in travel medicine. And that takes the form of teaching and research and faculty development. Another role I currently occupy is the president of the International Society of Travel Medicine. In fact, I have only just less than 4 weeks left in that role, and then I become immediate past president for another 2 years.
So that's certainly a lot of jobs that you're juggling all at once. And it's great to have a travel medicine specialist because it's certainly a rarity in Malaysia, to my knowledge. So thank you so much again. The second guest on our podcast today is
Datuk Lukman. It's such a pleasure to have you here. Why don't you introduce yourself?
Thank you very much for having me too here in this program. I'm Lokman Hakim S. I'm Professor of Public Health with the Department of Public Health and Community Medicine, School of Medicine. And I'm also holding the portfolio of the Deputy Vice Chancellor for Research. Well, I must qualify myself that I am not a travel medicine practitioner, per se. Right. When I was in the Ministry of Health before, I was in charge of the public health programs that include the primary care services in the country. And I believe travel medicine has not been given much priority. All right. And I was fortunate to, when after joining IMU and getting engaged with Professor Gerard, and that's how we get involved in this travel medicine business. Thank you.
That is amazing to hear. I think our listeners will be more than happy to see how public health and travel medicine intersect, especially in Malaysia.
It's a great adjunction, truly. And before we dive into the podcast and really lay a foundation for what travel medicine is, I think Prof Gerard and listeners, please be known that he gave me the permission to call him Gerard. So that's how I'm going to be addressing him throughout this podcast. So Gerard, why don't you tell us what Via Sana is? I think our listeners are really curious how you coined the term.
Okay, thank you very much. Via Sana is Latin for healthy way or healthy journey. And people will be familiar with the word sana, votre santé in French. And so it's quite similar to that. So the idea of protecting people's health when they travel, that's where the term came from. And, you know, when you put Latin on something, it always lends a certain grandeur to it, I think, doesn't it?
I mean, I agree. I think Latin is beautiful, and I'm pretty sure our listeners weren't aware that there is such a deep meaning to it. I think this will incite your curiosity.
I mean, even most of the medical terms are from Latin and Greek too. So I think it's really fitting that he picked that language.
Yeah. So with that, why don't we jump right into what we are going to discuss today? Prof. Gerard, why don't you tell us what travel medicine is, because we actually went out in IMU and had a conversation with a lot of different medical students. I would say they are more aware of what travel medicine is than others, but I heard a range of different definitions, from getting vaccines before traveling to buying pills to just going and visiting the doctor. So let's just have the expert explain it to us. What is travel medicine?
Okay, no pressure. Travel medicine, it has another term actually, but it's rarely used, and that is emporiatrics. So you could say a travel medicine practitioner is an emporiatrician. But again, that term hasn't really caught on very much, so we still call it travel medicine. It is a specialism. I can't say specialty because it doesn't have specialty status in every country. It does in the country that neighbors Malaysia, that's Thailand. It's a formal structured residency program there, so you can say it's a specialty. But in most other countries, you could call it a special interest or a specialism. It's multidisciplinary, so it doesn't just belong to physicians. It's also practiced to some extent in different ways by both nurses and pharmacists as well. So it's truly transdisciplinary, which is one of its great attractions, I think. And it's a specialism that's concerned with the preparation of travelers who cross international boundaries. Straight away, there's a problem with that definition, but that is the conventional approach that we've always followed. A few of us think that we should broaden that to include countries that are large and very diverse in their travel health risks. And there are obvious examples of that around the world. But at the moment, it pertains to travelers who cross a border. And it's about prevention of communicable disease, that's infectious disease. There may be a different level of risk of that infectious disease in the destination country than in the patient's or the traveler's host country. But not just that, it's not just communicable disease. It also extends to preparing the traveler, giving them advice about reducing the risks associated with non-communicable disease. And this could be things that relate to the traveler's own medical comorbidities, a traveler with some complex medical conditions, for example, and also injuries and trauma. And in fact, the single greatest cause of death in younger travelers, and you interviewed younger travelers for your poll, is road traffic collisions, and that's something we often overlook. But it's interesting to hear that your audience straight away thought of vaccines. That is a very fundamental part of travel medicine, of course, and that is about preventing vaccine preventable diseases. But that's not the full story.
All right. I mean, I agree. I think travel medicine, being as broad as it is, it's very interesting to know that you still can't call it a specialty, that we call it a specialism. And even though it's a specialty in Thailand, and it's so broad, which is why I would like to ask you this question. Is there anything special or specific to travel medicine that makes it unique?
Yeah, so in travel medicine, it's really quite holistic. So we consider both the traveler, their characteristics, their travel history, their travel experiences, and the travel destination. So we ask a lot of questions as part of the risk assessment at the pre-travel health consultation, based on a very, I would say, extensive knowledge of the geographic distribution of disease, about the different health risks and environmental hazards in different countries, and about how different types of travel put the patient at risk of different complications. So we have a deep understanding of travel, destinations, and of course, we're very up to date when it comes to infectious disease outbreaks. Travel medicine is very dynamic, so you have to really keep up. From one end of the day to the other, you could hear about new outbreaks, and you have to be able to relay that information then in the travel clinic. One interesting thing about travel medicine is that it spans a continuum from pre-travel, so before you go, to during travel, because sometimes the doctor, nurse, pharmacist travels with the traveler. I was an expedition and wilderness medicine physician in my earlier days as a volunteer. And, that meant that I was traveling with a group of people to high altitude and then providing medical care there. And then post-travel. And that involves returning to your home country. But of course, you may return with unwanted souvenirs, with some illness that you acquired during travel, particularly an infectious disease?
I think that's really a niche position that travel medicine has in the healthcare perspective. So, Dato Lukman, why don't you tell us what cases you've seen so far in your years of medical practice that overlaps with travel medicine? Because we know that in Malaysia, travel medicine is not very vastly practiced. So, I'm sure there are some part of the healthcare system that has to compensate for the lack of travel medicine.
Well, as I said, I mean, although travel medicine is not be given a priority, but I think the the importance of it lies in the fact that Malaysians love to travel, right? It was estimated that from about 15 million Malaysian travels every year and spending about 22 billion Malaysian ringgit on travel. So if you imagine that if 15 million is that, it's about almost what 25% of the Malaysian population. And if only 10% of them suffer from travel-related health condition, it's about 1.2 million. And we are not taking care of these issues. We are not preparing our public, our travelers, and we are not preparing even our healthcare providers to appropriately deal with this situation. So I think there's a need for in this country, in Malaysia in particular, to look into developing travel medicine services and care. And this is where we are working closely with Gerard in this direction. Yes, even in this country, we have not recognized this as a specialty, but within the family medicine specialty, it is being recognized as an area of interest within that discipline. So, meaning in the curriculums of the family medicine specialists, they do cover certain aspect of travel medicine in their curriculum.
All right. So I think you've made a really good point that in the Malaysian context, I'm certainly sure that all of us Malaysians know that the number one killers are the cardiovascular diseases that has been brought up so many times. And we all know that how much of awareness Malaysians has been exposed to over these years. But certainly travel medicine has its spotlight. And I think we'll dive more into the details soon. But for now, I think I will jump back to Prof Gerard. This is for you. So I'm sure you said that just now that the path to becoming a travel medicine expert is not as straightforward because we know as a medical student, let's say when we ask our colleagues, what do you want to do when you finish graduating? I've never heard anyone say, oh, I just want to be a travel medicine expert. These answers are never heard of. And I think that just speaks about how prevalent it is in the medical students context. So why don't you enlighten us on how does one train to be an expert?
So this is a great question. And really the rationale for this student-led podcast is to increase awareness of travel health, travel medicine, as a potential career opportunity for young healthcare students, and also to make the general public more aware of travel health. Travel medicine is not old. I'm older than travel medicine. And so it really, the first international conference in travel medicine was as recent as 1988 in Zurich, Switzerland. I was only there last week. So it was wonderful to be there, knowing that the first conference was held there. The first conference of the International Society of Travel Medicine was held 3 years later in Atlanta, Georgia, where the Centers for Disease Control and Prevention are based in the United States. So really travel medicine is quite new. For a long time, it probably wasn't so necessary. But with the advent of wide-body jets and mass tourism and people traveling for discretionary reasons around the world, Datuk Lukman mentioned the great zeal that Malaysian people have for travel. This is a wonderful thing. They're curious about the outside world. And also, of course, there's significant population in Malaysia who travel to Saudi Arabia for the Umrah and Hajj pilgrimages. So these are very keen travelers and they want to be well prepared. 1.3 billion or so people traveled in 2023. The number is going up all the time. Of course, it took a dip during the COVID pandemic, but it recovered very sharply since then. And there's projections it'll go well beyond that 1.8 billion and beyond in the next few years. So the need for travel medicine professionals has never been greater. How do you train in it? Well, it's it's not straightforward, as you say, but I think it is very important that those who practice travel medicine are do receive some training in it, and that could involve, at the first step, I would say, completion of a short course or micro credential. And I know IMU University is offering one now in travel medicine, so that's an excellent first step, and that would introduce people to it. Beyond that, there are various diploma courses available on various continents. There's quite a few in Europe and quite a few in the Asia Pacific region as well. I did mine in Glasgow, in Scotland, not too far from Ireland actually, and that's where the Faculty of Travel Medicine is based at the Royal College of Physicians and Surgeons of Glasgow. So that's a very well-known place to do the diploma. I went on from there to do a master's in International and Travel Health in England, in the UK. So there are fewer master's courses in travel medicine around the world, but there are relevant master's courses in other disciplines like public health, tropical medicine, for example, where there will be some travel medicine component. But I do think we do need more exclusive master's courses in travel medicine. And then some will go on to doctoral studies. I had the pleasure of completing 2 doctoral degrees, one of them under the supervision of Professor Datuk Lukman, so both MD and PhD in travel medicine. But that would be the minority of cases. Most, I think, would do a certificate, diploma course. Some would gain the certificate in travel health, which is really a very respected credential from the International Society of Travel Medicine. And then I think the key thing is to gain clinical experience in travel medicine. And so most people who practice it, at least in my part of the world, are family physicians, general practitioners. And so this is the perfect place really to practice it. There are, of course, specialist clinics who do only travel medicine and perhaps offer a wider, comprehensive range of travel health services. But really, most people who practice it are in general practice. And it is important. It is hard for a GP to be expert in everything. It's impossible. But those who choose to practice travel medicine within the primary care setting, I think, do need to ensure that they have foundations in travel medicine and that they engage in CPD, continuing professional development. And so that's important. I think it won't be for everybody. It will be for some people who choose to have a special interest in travel medicine. And I would encourage them to be as creative as they can, but certainly to gain some post-nominal credential in travel medicine and to join both their national, if there is one, Travel Medicine Society, the regional one. In the case of Malaysia, that's the Asia Pacific Travel Health Society, which is a very vibrant society. And then, of course, the International Society of Travel Medicine for those who want to take it further and get deeper in the discipline of travel medicine.
All right. I think it's in a way, it's nice to hear that there are so many paths to get trained, and we definitely visualize a future where there's widespread training opportunities for anyone who's interested in travel medicine. We are truly honored to play our part in creating that future as well.
So listeners, if you are thinking, travel medicine sounds cool, so I hope you jot down everything Prof Gerard just spit it out. I think that'd be a really good guideline as to how you'd end up just like him. Maybe you would be a travel medicine when you do your post-graduation. Who knows?
Who knows? All right. So now moving on. Prof. Lokman, you mentioned about how there are so many travelers just in Malaysia alone, and you talked about even the religious traveling, which is just one of the many aspects of travel that's there. And I can see with just the rise of globalization, just how important travel medicine is in general. So I'd just like to dig deeper into that. What is the role that travel medicine occupies in today's medical landscape, and just how important it is?
Well, if you consider the pandemic that we have just experienced before, traveling is one of the key contributors to the spread of the disease, right? So to me, that really explains the importance or justify for the importance of everyone, the practitioners, the students, and even the general public, of the importance of be prepared for your travel, right? We mentioned, Gerard mentioned about traveling for mass gathering event, religious or even social mass gathering event. In the Malaysian context, if you think carefully, it's not just about the Muslim. They are traveling for religious event. Do you know the largest religious mass gathering is the Maha Kumbh Mela, which is happening every 12 years. And this year, in January, beginning of January, was the year of that celebration. And do you know how many are traveling for that? 125 million people are being exposed and at risk of some form of travel vaccination. So other religious, we only, in the Muslim, we only know in Malaysia about Hajj and about Umrah. But there is also another religious travels, like for example, the Abain to Kabbalah in Iraq for the Shia religious rituals, which attract 15 to 20 million, and Malaysian is part of it. So if we look at the travel medicine in this country, yes, there is some form of an organized travel medicine service only for this purpose, the Hajj, for the Hajj especially. But even for the Umrah, there's no structured program to manage the Umrah pilgrims. Whereas in the Malaysian context, as we consider in that context, the number of pilgrims for Umrah is much, much more than the Hajj. The Hajj is only about maximum about 30,000. But we are talking about 300 to 400,000 Muslim Malaysians going to do the Umrah. And yet, we do not have any structured program for those. So I'm a little bit passionate about mass gathering because to me, there's a real risk, both Muslim and non-Muslim in this country, with regard to travel-related mass gathering activities. So probably that one particular aspect, I think in this country, we need to have some policy or something like that we can develop the services to address these issues. The other aspect why I think this is important because from the various studies that including what Gerard has been doing at the airport, the airport survey, the airport study, it shows that Malaysians are not prepared in terms of for their travels. Only 40% of them have sought some forms of pre-travel consultation. Only 40%. Surprisingly, another 50% doesn't even have any medical insurance for travel. It's very risky behavior. And to me, insurance is part and parcel of the travel medicine business. Because that's important when you are fall sick in foreign country, you need to be protected. I mean, imagine. And a large 60% of them doesn't even know how to access healthcare in the country. So these are some of the risky behavior that we are seeing among our travelers. So that's why I say it is very important aspect of care that I think we need to seriously look into, both at the policy levels and as well as at the practice level.
I couldn't agree more. I think Datuk Lukman has said it very clearly there. You might be interested that in ISTM we have established in the last few months a new interest group. We now have, I think, 10 interest groups, and the newest one is called Mass Gathering Medicine.
Oh, okay.
So I think this is one that you can add a lot of value to Datuk Lukman because you have a great interest in this. And the students who are listening may be interested to know that mass gatherings extend even beyond what we've discussed there to include things like sports events, so sports tourism, and music festivals and things like that. So you can see that travel medicine encompasses such a wide array of different exposures, and that's one of the things I think we enjoy about it. It's never boring. It's certainly not dull. It's changing all the time, and you can intersect with a lot of other specialties. I think that's one of the fun parts of it.
Oh, okay. So I think what Dato Lukman said really brought up a good point again, which is saying that Malaysians, especially in travel medicine context, have really not a lot of awareness. And I mean, you don't want to end up in a hospital bed while you are halfway in your dream trip to Bali, right? So I think certainly travel medicine deserves its spotlight, and certainly that's why we are doing this podcast in the first place. So why don't we jump on to the next question?
Yeah, and I agree with Madhu, and it gives us a nice segue into giving our listeners a teaser to our future episode. So, Prof. Gerard, would you say that there are special scenarios or special events in anyone's life where the person should specifically seek out a travel medicine doctor?
Yeah, so I think everybody who travels abroad should at least consider the travel health risks. So some will, I think, have a sufficient level of risk in order to see a travel specialist or attend a travel clinic. Others may not. It will depend on their perception of risk. But it's certainly, they should be aware of the potential travel health risks associated with their type of travel and their destination. So, making the public aware of travel health risks and protecting themselves and self-treatment and so on is an important part of travel medicine. Dr. Lokman mentioned that not everybody attends a travel clinic when they should. And so, the figures suggest that about half of people don't who should. And so we don't access these people, but they may still get some advice from other sources. It could be family or friends, it could be the internet. Nowadays, it can be generative artificial intelligence. So, we are very aware of that in travel medicine. We're trying to make sure that the resources that are available to the general public are of high quality. We have a series of fact sheets within the ISTM, which people can just view on our website for free, even if they're not members. We're trying to grow that database, so that'll be helpful for people, not even if they don't attend a clinic, but also if they attend a clinic and they want that information to be reinforced. Because in a clinic, you don't have a lot of time in your consultation. You may have 20 minutes if you're lucky per traveler. And therefore, you have to transmit a lot of health information within that time, perform a risk assessment. And it's very useful to provide supplemental written information to reinforce that. So I think, yes, I think everybody should attend a travel clinic, but of course not all will. At least those with higher risk itineraries should. And it is important then that within that clinic visit that they have access to a comprehensive travel medicine service where there will be a formal risk assessment performed and that they will be given specific and I would say customized advice, not just generic advice for everybody, but that the advice would be individualized to them. And it takes experience to do that because you have to know the traveler and their unique vulnerabilities. I have a special interest, as Datuk Lukman knows, in travelers with pre-existing medical conditions. And these are amongst the most vulnerable of travelers with diabetes, cardiovascular disease, asthma, mental health disorders. And it's important to know what kind of advice each of these travelers needs for their specific journey. Every journey is different. And so you may have two people who are going to Malaysia on a holiday, but have really a very different level of risk based on their own individual characteristics and their planned activities at that destination.
I agree. I think the importance of risk assessment cannot be understated. And thank you so much, Dr. Gerard, for specifically focusing on that. And dear listeners, all these topics that we discussed today, mass gatherings, travelers with pre-existing conditions, I'm sure a lot of it will resonate with you, and we will be discussing it in our future episodes. So please tune in and listen.
All right. So now for the most awaited part, the fun bit. So Prof. Gerard again. So over 20 years, you've been in this travel medicine field, right? Tell me if there is one story that you have saved for your grandchildren to tell them that would make you look really cool, and how it has played a role in just healthcare in general. Has it saved a really fatal life, or what other fun stuff? Let us know.
Preventive medicine is less glamorous than emergency medicine because it isn't obvious that you've saved any life or that you've prevented any illness. So those who practice preventive medicine are very aware of risk and reduction of risk and mitigation of risk. And so they don't need, if you like, the immediate gratification of seeing that a person has recovered. We're really trying to prevent illness. So my advice is for those who are interested in travel medicine, I think be aware that you may not even know the outcome of the person's travel. But if they're not returning to your clinic ill, that in itself is a significant achievement. So I think over the years, travelers that I've seen who were ill when they traveled, and who reported not having obtained any travel health advice before or during travel, and they return ill, that reinforces to me the importance of giving preventive advice and travel vaccinations. I have a special interest, as you know, in high altitude medicine. And in my earlier days, I used to travel as a volunteer expedition physician for a local cardiac charity here in Galway. And I was the team physician, but I was also a fellow trekker. So it was a unique situation because I'm trekking with them. I'm staying in tents as well. And I'm also, struggling with the hypoxia at high altitude, but I'm also having to provide medical care to them, sometimes on an emergent basis. And over the years, there were cases of high altitude illness, in some cases very severe and life-threatening, which I had to deal with. Cases of high altitude cerebral and high altitude pulmonary edema. Maybe we'll talk about that in a later podcast episode. But it really reinforced to me the importance of staying well yourself, because as I told my fellow trekkers, I'm no good to you if I'm sick as well. So it's very important that I stay well. But you need to know what to do if I get sick as well. So we had a portable hyperbaric chamber, which is my own, and I've used at high altitude quite a bit. And I always made sure when we did a dry run of it before we traveled, that they also learned how to use it, because maybe I would be the casualty with severe high altitude illness who would need their treatment. So I guess high altitude or expedition medicine is quite a unique scenario where you're traveling with the traveler and rendering medical care. I review a lot of manuscripts for travel medicine journals, so I come across a lot of cases. I've had a few over the years, but maybe not as dramatic as some of the ones that I've reviewed. But if you read the clinical pearls section of Journal of Travel Medicine, you'll read some very interesting and some quite bizarre case reports, which will remind you of some of the maybe more unusual health risks associated with travel. So I commend those to you. You can read them in your own time.
All right, so that certainly gives us a view on what exactly goes on in a travel medicine expert's life. Though it may not give adrenaline pump as an ER doctor, maybe it certainly plays a much more important role in travelers, because we know the population around the world that travels, like Datuk Lukman mentioned just now, is vast, and there are a lot of scenarios that needs to be handled. And I think the preventive care part that is in the travel medicine is truly one of the lifesavers in many ways than we realize. So thank you again for emphasizing on that.
Yeah, I mean, I agree with Madhu. Life might not be a Grey's Anatomy episode, but knowing that you're able to prevent a much worse outcome for so many patients, considering how many are traveling, must be so much more satisfying. So,
And can I add to that as well, if you
yeah,
allow me? Preventive medicine is more cost effective as well. Dr. Lokman is an expert in public health. In terms of health economics, preventing illness should always be the aim. And I think modern health systems are starting to wake up to that. And I think it's important that as you as medical students try to embed the practice of prevention in everything you do, even if you go into emergency medicine. We need more prevention. I think it's very important. Much cheaper, better for the patient, better for society.
Yeah, I think it's a very important element in the travel medicine, the preventive component of it, like vaccination, for example. You prevent from getting certain specific diseases, depending where you are, the countries that you're visiting.
Mm-hmm.
Now, for example, in Malaysia, we always thought, we travel. We are from the tropical countries. We have no problem with dengue. We have no problem with malaria. So why should we be protecting ourselves? But when you are visiting some European countries, for example, you might have a risk of thick encephalitis. Are we aware about that? Are we protecting our Malaysian population, travelers, when they are going for exotic travel to the European or the state, going for hunting and whatnot, right?
Yeah.
And they are at risk of developing, acquiring tick anaphylaxis, for example. And vaccination is a very important preventive strategies that need to be taken. And I think
Absolutely.
probably on a personal aspect of traveling, I love to travel. And recently I went to Uzbekistan. And yeah, I'm supposed to be a medical doctor. I'm supposed to prepare myself. I get ready all the medication and forgot to bring one of those medication. But suddenly, in Tashkent, I have some problem with my knees. I need some medication. Communicating your health problem in Uzbekistan is not easy.
Yeah.
They don't speak English, they speak Russian. So how are you going to tell your problem? So this is a small thing, but it's challenging. I mean, this is something that we need to, something that we need to provide this, to our travelers when they are traveling, to be aware of what they're going to face when they go out there. As I was mentioning just now, one of the studies shows that more than 60% doesn't know how they're going to access that care in other countries. It's not as simple as just like us. We go to the pharmacies and buy the things. Some countries, they don't allow that. So this is part and parcel of preventive medicine, of understanding what's the risk you're going to face in those countries and try to prevent that from happening.
If I could add to that, I think that's absolutely spot on. One of the things we discuss with travelers sometimes is how to transport certain medications across borders. And we find travelers are quite poorly aware of some of the restrictions on certain compounds. Some of them quite frequently used medications like pseudoephedrine or perhaps even codeine as an analgesic, and then others that might be psychotropic drugs. So we have to be able to give advice to that. Our pharmacy colleagues are very expert on it, but every travel medicine practitioner should have the basics around that. And Datuk Lukman mentions obtaining medical care overseas. This is fundamental, and it is one of the skills of a travel medicine provider that they would know about the health services in different countries. Global health really feeds into travel medicine because you do need to understand what are the limitations on healthcare in different countries. Some people may have a notion that, well, what can possibly go wrong? The embassy will look after me. I've had travelers say that to me. But of course, the embassy cannot provide money for your care. They can help with certain things, but it is so important to have travel medical insurance that Datuk Lukman mentioned, and to ensure that it covers you for repatriation, medical evacuation, and that it covers any pre-existing conditions or any special activities you're doing. So these are the things that occupy us in travel medicine. We do think about what will happen if the traveler becomes sick. Have they a health management plan if their pre-existing illness becomes exacerbated? So sometimes we have to focus on the negative, and we have to talk about a risk a lot and reducing risk and so on, and hazards. I always try, if I can, to mention something about the benefits, because I have a special interest in research around the health benefits of travel. So I think via Sana is what we're trying to achieve here, a healthy journey, and recognizing that travel is a wonderful experience for people. And you don't want to travel and then your only memory of that, or your predominant memory, is of being ill or hospitalized abroad.
I think that's the thing. I think we've had a lot of deep conversation here about just how much travelers are missing when it comes to taking care of their own health, and a lot of mistakes and slip-ups they are making, thinking that the embassy will take care of them, thinking that nothing bad will happen to them on their dream trip in the cruise or to Bali. And just as an extension to knowledge that travelers should have, we think it's very important that medical students should have knowledge as well. We discussed the possibility of a future in travel medicine. They should definitely know now as well. And Datuk Lokman, you are in a very unique position as an IMU faculty member as well. So I would like to pose this question to you. Is it possible to increase the exposure that we as IMU students have to travel medicine? Do you have any ideas for that?
Well, I think the first thing that needs to be done is to create that awareness first among the student as well, and also, the general public out there, right? It's important to create that awareness, because without that awareness, people don't see the importance of acquiring whatever knowledge there's no point of the university putting out modules for the student to take when they don't see the importance of it. So I think this is something that we need to work on. And we are glad to have Gerard with us, who has been guiding us in that process. So hopefully we'll be able to come up with something concrete in the years to come. My bigger concern is actually about, as I said, about the practices set out there among our clinicians and in primary care services in the countries. We need to continue to work on creating that awareness. And we have started that. Early this year, we had our first travel medicine seminar in the country, hosted by us with great support from Gerard. And based on judging from the participation for that seminar, we got 150 registered. Shows a great interest in it. And mind you, we are doing this within just 2 months. Gerard, only 2 months work of trying to come up with some module. So I think there's a great demand for of knowledge in this aspect of medicine, and this is something that I hope that we can work within the universities, and certainly we will certainly appreciate the contribution from and support from Gerard in this aspect.
I think that's truly amazing, because not only IMU students would be gaining the awareness, but hopefully through this podcast, we are aiming to spread this awareness to possibly students all around Malaysia, but not just students, of course, the general public who are also at a higher risk of travel-related illnesses, right? So with that being said, I think, again, I'm going to jump back to Prof Gerard here. So he's the travel medicine expert here. If our listeners are really curious on diving deep into a more in-depth information for travel medicine, what are the sources they could look for, and where could they find it?
Well, again, I'm biased here, and that is my conflict of interest as president of ISTM. But I would encourage people to join ISTM, and students receive a special discounted rate. It's very reasonable, and they receive all of the benefits of membership, and they're really very many. There's regular webinars. There's an annual course for those who want to take it further. They will receive a lot of useful information. So I think that's a good place to start. Join as a student. And then, hopefully then as you join that network of global travel medicine professionals and maybe present some research at a future travel medicine conference, maybe even get a publication in the Journal of Travel Medicine, which is a really esteemed publication, then a person's career could really develop from there. And they may pursue travel medicine as their main interest or as part of their own career in family medicine, infectious diseases, public health, occupational medicine, or whatever. So I think joining a society would be the way to go. Asia Pacific Travel Health Society membership, I would strongly recommend it as well. And there's about 35 or so national travel medicine societies in the world. Not everyone every country has one. Malaysia doesn't have one yet. We're already discussing whether that might be something to do in the future. But there is an excellent Malaysian Society of Tropical Medicine and Parasitology. So I think joining a society, you get to spend time with like-minded people who share your passion for the subject. And I think it's a great way to proceed. Then from there, some people may want to do our micro-credential course in travel medicine, which was recently launched. This started off in life as a MOOC, a massive open online course. So I have an adjunct professorship in IMU University. So this was just part of my contribution, and we developed this between us. And it proved quite popular. So then it was recommended that maybe we could expand it and convert it into a micro-credential. And I'm sure it will grow over time. And I think that might be a very useful step for people. And there's no reason why laypersons, people who love to travel, want to protect themselves, or members of the travel industry wouldn't do that course as well. I think that it's very open and very accessible to a very broad broad range of people. There is lots of useful information for travelers online, be it on the WHO website, CDC, Fit for Travel, which is provided by the NHS, National Health Service in the UK, and others as well. And of course, there are lots of textbooks out there, but I think joining a society would be where I would begin as a student.
Yeah.
Well, probably you will also be interested to know where does Malaysian get the information about travel medicine? There was a study by Chow et al. That was published in 2018 in the Southeast Asian Journal of Tropical Medicine and Hygiene. 39% of them get information from their family members and friends.
Absolutely.
Another 40% is from the internet.
Yeah.
And only 12% are from medically qualified doctors.
It is worrying.
There's an important role of having this information readily available in the internet. And I think this is also a part of contribution that we should be promoting, creating more materials for people can access. Because, out there, people will love to go just to as best, although we want them to go and see a travel medicine practitioner. But, habit is habit. But as long as they can acquire some form of information about the travel, I think it's important for us to provide those opportunities for them to get the right information. And I think what we are doing here is something very important, and I think that should be made available even to the public, not just our students.
I think that's an excellent point. If I could come in, I think I agree with that entirely. Podcasts are actually a great medium, I think, for instructing the general public, and usually they're short and bite-sized. ISTM has its own podcast series. It's maybe at a different level, aimed at the travel medicine professional, but people can view those for free also on YouTube. But we did a study some years ago looking at the websites of professional organizations, maybe national or international organizations relating to cardiology or diabetes or asthma or something, obesity. And we looked at whether or not they had any information on their public websites for travel. And we found that the minority had, so very few had at all. And that information, when it was there, was very patchy and fragmented, and there was very little detail in it. So we think that's a very useful way as well. Reach the patient, especially the vulnerable patient, through the patient organizations as well. So I commend what IMU University is doing and trying to raise public awareness of travel medicine and trying to encourage healthcare students to develop an interest in it as a future career opportunity.
Yeah. So Gerard has put it very eloquently as to how students can have their first step into the world of travel medicine by joining a society. I think that carves a really good pathway for a future expert in travel medicine, right? So I think from all the discussions we've had so far with these two experts, it feels like we've really been sleeping on travel medicine, because the benefits of travel medicine practice sounds like it's a really crucial role in healthcare medicine. And it's really a surprise that it hasn't been a really vast field in healthcare all around the globe, not just in Malaysia. So I hope from this podcast that we would be about to share this knowledge to as many people as possible, and also in the next few years, possibly, this could become a really vast field that every medical student around the world is interested to join in. I think that would conclude our discussion for today, right?
Yeah, of course. I mean, I agree with Madhu. I think travel medicine does occupy a very important position right now, both in the case of the general context or in the case of the healthcare context. We predict, and I think now our listeners predict as well, that with time, travel medicine is going to be everywhere, and it's just going to occupy such an important role. And we feel really honored to be a small part in this. And at this point, I think I would like to thank our esteemed guests for doing us the honor of joining us in our first episode of Vyasana. And to our listeners, let me tell you all the interesting topics that we discussed today: mass gatherings, going in the high altitude, everything, your future, and seeing more travel medicine. We will be discussing it more with other interviewers, other guests, and of course, Prof Gerard. So please tune into to our future episodes.
Yep, I think we've laid a pretty good groundwork as to what this entire podcast is going to be like. So if you're interested in listening to more and gaining much in-depth knowledge on this field, you have to tune into it. And again, thank you so much for Prof Gerard and Datuk Lukman for joining us today. It's been a pleasure
Most
having you
welcome.
both.
Dermot Cassie, it was a great pleasure.
A great pleasure, yes.
Thank you. We really do thank you. And with this, we would like to conclude our podcast. Thank you so much.
See you again in the next episode. Bye-bye.
Bye-bye.
Bye for now.
If you liked this episode, hit the like button and share it with your friends.
For more updates, find us on YouTube, Instagram, or Spotify.
If you have any questions, do put them in the comment box below or DM us on Instagram.
Until then, this is the Via Sana team signing off.